Tuong with Hand Therapy Secrets, and I got a question and I wanted to share it with you. So this question comes from my free 30-day hand therapy training. So if you haven't done that yet, then I'm going to include that link for you so you can join at any time, and it's a go at your own type of pace. So make sure you read the email from me, because it kind of gives you the directions of what you need to do and how that program works. But I've got tons of students. I mean, I'm really amazed at the number of students that I've gotten into that program from all around the world. And so I got this question and I thought, let me go through it with you instead of just her, because I think it's great to share. So this is a distal radius fracture, and they had an ORIF, I'm assuming, and they've had about 6 sessions of occupational therapy. And when she extends the whole arm, right? So I'm thinking extends the whole arm. This is my imagine of extension, or it's back here, but I doubt it's back there. I think it's here. The IP joint of the thumb goes into flexion that she can't control. It does the same even when the wrist is in extension. So if the wrist is in extension, the thumb goes in, right? Have I got an idea? I think I got an idea. I see this all the time. So definitely I want to help you think through what that might be and why, right? Because we know what it could be and why, it makes it easier for us to be able to help somebody with this particular problem, right? So this is exactly what I do in my hand therapy mentorship program. I'm going to include that link below for you so you can check it out. It's a month-to-month type of program, and it gets us face-to-face. So it allows me to be able to help you and get through some of these challenges that you might have, but also kind of teach you why something is the way it is, and then that way I can show you what you can do and how you can do it, right? So what happens in a distal radius, so let me see, do I have a pen on me? I do not have a pen on me. That's okay. You can imagine this is a distal radius, and you have an ORIF, right? So imagine what gets cut through here and what bypasses through here, right? So one of the tissues that get bypassed through here is the Flexor Pollicis longus. The Flexor Pollicis longus is the muscle that bends the IP of the thumb. And where does that muscle originate and insert? Now, this is not anatomy. You don't need to know exactly where it is, but what you want to know and you want to think through is like, what passes through here? And if that particular muscle passes through there, what happens to it, right? So the Flexor Pollicis longus starts in the forearm, right? Starts in the forearm, it passes the wrist, it passes the MP, and it inserts into the IP, right? Into the distal. And that muscle bends the IP. It can also secondarily bend this, but it also passes the wrist and it pulls into flexion. So if you have someone with a distal radius and they are able to move their wrist, right, but their IP gets a little stuck into flexion, might be because there's scarring, right? It might be because it's tight. So a lot of times if the wrist is in neutral, you're moving that IP, you're like, oh no, it's fine. But when you think about composite, so as the wrist goes all the way back, that muscle has to tension, that muscle has to stretch all the way out, right? And it has to pass the MP and it has to pass the IP. It's a great way to stretch and make sure that everything is moving and gliding throughout that area. And that way people can move better, have less pain, and they move everything so they have less adhesions, all right? So I hope that helps you sort of think through a particular problem, and you can take that kind of critical thinking, breaking down of something into another problem you might have. I hope you enjoyed this video. If you are an occupational therapist and you're looking for some mentorship so that you can learn quicker, right? I've got this huge extensive library, and you don't have to start from video 1. You go in there and you pick what you need. Is it a shoulder problem that you're struggling with? Is it a wrist problem? Is it a hand problem? There's wound care. You're struggling with some splinting. If you're struggling a little bit and you have no one to really go to make sure you're on the right track, you're progressing someone, you're doing things correctly, then you get to get on a call with me weekly. Every week we meet on Thursday, and you get to ask your questions. I'm going to help you think through the problem so that you can have a full understanding, so you can take it every single time to the next person, the next person, the next person, right? And I'm going to include the link for you. Sign up today. Now, if you're not sure it's for you, just give me a holler. I'm happy to talk to you. Make sure that this is the right program for you. If you're a student, you're just not ready for anything like this, hit the subscribe button and get more videos from me.